I'm going to try to do this relatively fast. My job in the next 7-8 minutes is to talk about using the Supercross microcatheter to get out of some really impossibly difficult situations. So, you know, angles and bends are part of interventional life. I mean, that's just the way these things are, and it makes accessing branches and main vessels quite difficult. And the Supercross is a family of catheters with a bend at the tip. The most common ones being the Supercross 90 and the Supercross 120, and they all have a specific purpose in helping you get through cases. And so conceptually, when you think about the Supercross catheter, it gets you places that are challenging, and I like to think of it as two basic mechanisms how this catheter works. One is, I like to call it meet and greet, where the catheter goes to the place where you need to go and then helps you get the wire. And the other one is point the way, which basically means the catheter directs the wire in the general direction of where you want to go. And so that's illustrated up here. Here's an example of an angulated vessel with a funny takeoff. Normally, when you try to wire this, you would be able to engage it, your wire will get in, and then it will prolapse down, and that's about it. So with the Supercross catheter, what you're able to do is you put a wire down, and then you put the catheter over it, and when you put it over, the catheter bend sort of straightens itself out, and you go beyond the lesion, and then you pull the wire back, and when you do that, the catheter sort of reforms the bend, and then you're able to sort of pull it back and gradually almost engage the side branch you want to get into, and then advance your wire. So that's the conceptual framework. You're meeting the vessel where you want to go and greeting it and pushing your wire down. And the tips and tricks of doing this is the fact that you're engaging a three-dimensional vessel or branch in two-dimensional space. And so it's a bit tricky, but you know, we're interventional cardiologists. We've been doing this with the right coronary artery for ages and ages. So it just involves very fine movements of the catheter back and forth, clockwise and anti-clockwise, very fine movements, quarter turn at a time. And then it also involves very fine push and pull movements of the catheter and push and pull movements of the wire. So you can't shove a wire in with brute force. You want the wire to find the vessel and get in. And sort of, I wanted to illustrate this up here. So you can see that this is the ostium you're trying to engage. On the left is the Supercross. And this is the three-dimensional object. This is the two-dimensional projection, which is the angiogram you see on the film. And you can see that I'm bringing this now close to the oops. I can't seem to get it to work, but I mean, the point is that you're bringing it close, and in two-dimension, you may be not in the right plane, and you have to move it back and forth to get it through. And when there's severe ostial disease, there's always the potential of dissecting the ostium, so you have to be careful when you do that. The other way where this works is the sort of what I call point the way, in which basically you've got a vessel that's at an angle, and you're trying to engage it. You can't get it with a wire. The wire prolapses out. And when you use a Supercross, it just points in the general direction without engaging it, and you're able to get your wire through. So that's, again, the conceptual framework. So I'm going to try to show you a couple of cases. I hope they play, because that other video didn't, where we're going to look at a couple of cases, then we're going to look at the history, the anatomy, the problem, and what the solution was. So let's see if it works. If not, then that's the end of this talk. So this is the case of an anterior STEMI, and we opened up the vessel. And so that's the anterior STEMI, clearly bread and butter stuff. We opened up the vessel, and then we saw this diagonal coming off at a really odd angle, okay? We tried multiple wires with multiple bends. It would not go. It would go in and then prolapse. So let's look at the problem. The problem is a really odd retroflex takeoff of the diagonal, and you can't get into it. And the solution is a Supercross. And I'm going to now show you in real time what's happening. Here's the Supercross. There's a wire beyond it. And I'm going to push the Supercross down and then try to bring it back and engage. And this is all in real time, so it's not, you don't get it immediately. It's not that good, but it's pretty good. You just have to follow and see what we did. So now I'm pulling the Supercross back, and right now I'm in the wrong place. I don't know that yet, but I'm in the wrong place. And then you'll see in a little while I'll give a puff, and I'm way below the diagonal. So I pull it back a little bit, clockwise, counterclockwise, torquing it very gently. And then you'll see that I try to, play around with the wire, and the wire doesn't go because it's still in the wrong place. And you just sort of follow the visual aspect of it. This is all in real time. Nothing is fabricated. So I'm still missing it. Now I torque the catheter like a Judkins, like you do to a Judkins, and there you go. I engage it. Now, once I've engaged it, I gently push my hydrophilic wire, and I've got the vessel. The rest of it is usual angioplasty stuff. We ended up doing a DK crush because this was so difficult to wire, and that was it. Another case, a 54-year-old man, this is a colleague of mine's case. A colleague of mine did this case, anterior STEMI, and here's the anatomy. You can see that the LAD is flush occluded at the ostium. So what, you can see the problem is flush occlusion of the LAD. The entry point is ambiguous. And what do? He tried with several workhorse wires. He would be able to engage the vessel, but it would prolapse. He then tried with the dual lumen catheter, and a lot of people say, well, use a Crusade or a dual lumen catheter. It doesn't work as well for these kind of things. He tried that, it didn't work. Then he tried an IVUS, so he went with an 8 French and tried IVUS guided, and that didn't work. So then Supercross 120. So I'm going to show you here first, he's using, he's got the Supercross sort of placed close to the ostium of the LAD, but it is not engaging it. So it's just pointing the way. It is not engaging it. And you can see with the Fielder XTA wire, initially he fails, tries again, and you notice now in a second it will cross. All real time, there we go, we're across, and then the rest is usual angioplasty that you all are familiar with. Another quick case, 34-year-old man, lupus, CTOs. We fixed the RCA CTO a few days ago, and this is the LAD CTO. And I just want to show it to you. It's an odd-looking LAD CTO. It's hard to know where the cap is. So let me just show you what the problem is. LAD cap is ambiguous. It's, I don't know, somewhere here. And so we need a way to get into it without missing it. So what do? We took a Supercross, and the concept here was meet and greet. We want the Supercross to engage it. Before this, we tried workhorse, dual lumen. None of that worked. And so let me see if this will play. And it is playing. So here's my wire going across. Actually, this is the dual lumen first failing. I just wanted to put that in there. So we're trying with the dual lumen. It fails. Eventually, we managed to engage the vessel, but then the wire just pops out. And then we swap strategies, and we then go and put a wire down. So this is the wire going in. It's speed up a little bit just for time's sake. And then we take a Supercross. Here comes the Supercross 120. And we advance it, bring it close to where we want to be. And we're just beyond the ostium of the LAD. Then we pull the wire back, as you can see. Now back comes the wire. This is all in real time. And now I've engaged the LAD. And at this point then, I think we took I think it was a Gaia, if I'm not mistaken. And we put a Gaia in, and just having that angle there supported the wire enough that the wire was able to get through. And just in a second, you'll see, not straightforward, but it gets through. It just takes a little bit of persistence. And there we go, we're through that. And, the wire crosses. And again, the rest of it is just run-of-the-mill angioplasty, which you're all familiar with. And this is a final case. This is a guy with an EF of 25%, a lousy-looking LAD. And just look at that LAD. I mean, it's ugly. He's young, so we wanted to fix it. And let me just show you the anatomy is there. You have this really odd takeoff LAD. I mean, it's almost a 90-degree takeoff. It is diffuse, severely diseased. Not easy. We tried with a few wires. It wouldn't go. And at this point, then, we used a Supercross. This is, I think, going in with a microcatheter and a Fielder XTA. Let me just forward everything. Everything failed. We then went with the Supercross. And I just want you to, it's kind of pointing the way. It's not, I would not engage this diffusely diseased osteal LAD with the Supercross. You will end up dissecting it. What we did is brought the Supercross very close, as you can see over here. And once we brought the Supercross close, managed to wire it. And the timer, you see, this is 21 seconds. And you'll see in a few more seconds, we have successfully crossed. Before this, we were at it for about an hour and a half. Actually, my partner was at it for an hour and a half, and that's when I came in. And now you see I'm able to cross. And then, after crossing, and the rest is just usual angioplasty, we stented it, and it's all good. I'm going to skip this now just for the interest of time and just come to the conclusion that there are some lesions that are impossible to cross because of angulation and bends. It's just the way the anatomy is. Sometimes some of these are non-CTO and some of these are CTO lesions, so it's not just CTOs. And Supercross and 90 and 120 can be game savers in situations like these. And the key is to understand that the catheter manipulation and wiring has to be very, very gentle. Very fine movements, and the wire, you're just probing it. You're not shoving it in. You're probing it so that it finds its way. You just need the catheter to support it a bit. And in our experience, at least over the last many years now, the Supercross has bailed us out multiple times. Thank you very much for your attention.